Thank you, Dr. Suresh, and you are so passionate about this terrorism. I'm seeing you doing this work, IC courses for a long time, more than 15 years. I have guidance. So, coming to the graph fixation, to be quick with the presentation, and there are so many methods Dr. Ellen Kumar has shown, right from suturing, autologous, and the other methods too. So, what is the best for it? So the best of all the techniques is still the T-cell bags or T-cell. Maybe there is some problem with the availability, but it's freely available. Uh, Sometimes there will be a little problem with the stocks. So little tips how to use this is my present. First is you have to do very gentle cautery, not too much, because terrorism surgery you should not produce in inflammation. Because if there is a blood clot under the graft, then it make it dislodge. So we have to do very gentle bipolar cautery with a very low power, just to stop the bleeding, not to make the sclera white, just to stop the bleeding. There should be blood vessels and they should be visible. You should not worry about them. You should not bleed. That's all. What we need to cauterize. If you don't cauterize, if you don't need to cauterize, if there is no bleeding, but if there is a small amount of bleeding, better to stop it before you put the glue, because subconjunctival subgraft hematoma is a little bit very awkward, and sometimes the graft gets dislodged. Then coming to the application of the glue, we have two components. One is the concentrated protein sealant component. I prefer to take in two syringes instead of using their own applicator that's very bulky and very messy, and take it in a small needle, 26 needle, and put very few drops. Don't be very generous here, because too much glue between the graft and the sclera is not good. You need a very thin layer in conjunctiva autograft, not very thick, messy, very thick barrier between the sclera. We want to stick the conjunctiva graft to the sclera. We don't want a barrier. If you put too much glue, it will form a barrier, forms a thick layer. It takes a long time to get vascularization. Then a little bit we can press the uh, attach the graft, the conjunctiva, we can push it, then reflect the graft onto the bare area. We can wait 10 seconds before we shift it. So that much time it will take it to thickening and for both components to get mixed up. Then sweep over the graft and remove the excess glue from tissue glue from under the graft and the sclera. That's what I like it, so that there is a very thin layer, and the excess glue which has come out, just don't pull it off. If you pull, the graft also comes out. So uh, cut with the scissors, lift it and cut with the scissors whichever has come out while you are sweeping the graft, the glue. Then you take it off and keep it clean. Otherwise, sometimes the patient pulls off. The glue will be hanging like a tissue for 1 or 2 days. So the patients, while cleaning at home, they pull it and the entire graft will come out. So remove the excess glue and don't leave it there. And the other method for beginners, especially when you're starting the just, I mean, started using the glue, you are a bit scared that it will loss or conjunctiva get um, displaced. You can put two sutures of Tango Vicryl at the limbus. And this Vicryl generally I don't like, because it's very highly irritant material on the ocular surface. Patients are not very comfortable. Very initial days, we used to put two sutures near the limbus first and put on both the sides, one on this limbus, one on this, so it will fix the graft there. There is a graft in the position, and one more suture in the down near the limbus. And either if you don't have a glue, then you can put four sutures or six sutures all around to cover the other two areas. If you have started using the glue, then you don't need to worry about this. Then reflect the graft. Uh, this is for beginning, first few cases, to make yourself confident. Then reflect the graft. Then apply as shown before, just 1 or 2 drops of tissue glue and reflect the graft. And this is to make sure that your initial cases, you are not worried about the graft dislodgement. Then post-operatively, if you remove the excess glue within a week, they look very nice without edema. If you leave a lot of glue, what I found in my cases, we have a little bit congenital edema staying for up to 10 days at the graft site. The other two things, as Dr. Ellen Kumar has shown, autologous blood. Now, tranexamic acid also people are trying. I have not tried this, but autologous blood also works very well. But you have to keep the graft there for at least for 3 to 4 minutes without movement before you patch that. Thank you very much.